Yesterday, the UAE had its first case of a coronavirus sufferer being cured. We're here today at Aster Hospital in Al Qusais to find out how the virus can be cured, what treatments can be taken, and what preventative measures we can take to look after ourselves. A lot of people are thinking that the coronavirus is something that's very severe and lethal in all cases, but that's not true, is it?
Yeah, that's not true. Actually, coronavirus is like any other, respiratory virus. Coronavirus group actually causes normal cold, flu in human beings. But this novel coronavirus which has come is a different one from the animals. We're suspecting it's from the animals. The source is not completely traced yet, and probably it's a mutant coronavirus. That's why it is more virulent in human beings. Okay, so not all people get very sick. Most of whatever were the statistics we have for the epidemic going in China, we can see that like a small proportion of the patients are getting sick. That means if you are healthy, it may just pass off as a normal cough, cold or mild fever. But because of the number of deaths we are seeing and the level of infectivity of the virus, we need to be really careful. Now, regarding the case which got cured recently, which has been in news, there is no treatment as such for the virus. It is only supportive treatment. So body's immune system itself cures the virus completely out of the body. So it must have been a milder version of it. Okay, and if it's severe, definitely the patient requires hospitalization and treatment for other associated complications. Like suppose the patient develops pneumonia, there is a dip in oxygen level, you need to supplement oxygen. Maybe there is another secondary bacterial infection happening, so you need to treat with antibiotic. But for the virus as such, there is no antidote presently, and the WHO and people are working on it. So probably in the future, maybe we can have something.
I've seen a statistic that says like only 1 in 4 of these cases are severe. Is that?
It's quite deceptive because this is all based on the numbers that are coming out. So presently like around 34,000 plus people are infected. Out of that, you can see that 800 plus have died. So if you take a proportion of that, probably the fatality is like around 2%. It's all calculation, like more needs to come out to have a real figure. But it's very difficult to say how many are severe, moderate or mild, because the rest of the people are quarantined at home or hospitals, and we don't have that kind of statistic going all over the place. So only we can say that the fatality rate is probably this much and the infectivity is also high at the rate it's spreading. It may be very difficult to give a figure.
How do you treat then someone with coronavirus, whether it is mild or severe? How do you treat the sufferer?
See, normally the process here in UAE is that if a patient comes to a healthcare setup and you suspect a corona, that is if there has been a recent travel to China or contact with somebody who is known to be infected with corona, definitely this patient needs to be screened. Maybe his cough or cold is not corona, it may be some other virus. But what generally, if patient is not sick, the patient is quarantined at home itself. The swab sample is collected from home and sent to the national laboratory, which is under the government, and it's well networked. So if it comes positive, naturally the government takes action to isolate the patient and see that it is contained there itself. In mild cases, it's better it's quarantined at home because the number of people exposed is less. Because if in a hospital setting we can't admit all cases, mild cases, then it will be flooded with people like who are anxious or maybe who are not corona as such. So mild cases are usually quarantined at home. Moderate cases or severe cases which require hospitalization by the normal criteria, if suspected corona, are kept in isolation in hospital, and proper precautions are taken so that in case it comes out as corona, probably we are already been on the safe side.
And you said like in the normal way to treat cold or flu, that's how you would treat coronavirus. So you would lots of vitamins.
Yeah,
lots of
basic things. These are the basic health tips. Okay, if you are at home, then you should avoid, going out and exposing other people as well as exposing yourself to risk of other secondary bacterial infection. You should wear a mask. The patient should wear a mask so that his respiratory secretions are not thrown out at other people. And people who are taking care of the patient should be extra careful. So the main thing is mask alone does not protect. It's basically hand hygiene as well, because as of it what we know is that the virus spreads by droplets, the respiratory secretions. So maintaining some minimum distance of maybe 1 meter would be safe. And of course frequent hand washing, not touching your face, eyes, because once the droplets may be there on the objects and you touch them and the virus survives for few days, and with that hand if you're touching your eyes, nose, face like that, you may get infected even if you are wearing a mask. So hand hygiene, respiratory hygiene, and of course mask in certain situations. Not all, like the lay person who's going for work need not wear a mask always.
This case was obviously a mild case, the lady that was discharged yesterday. How do you then treat someone who's severe? How do you treat that very deep pneumonia when that
those kind of patients definitely require hospitalization in an isolated unit where there are special personnel taking one-to-one care of the patient with proper protection. That means it's complete protection of eyes, and of course the patient is also under mask and other things. And of course depending on the grade of pneumonia, like any other pneumonia, it will be treated. That means if the patient requires oxygen, it will be given. If there is secondary bacterial infection, antibiotics will be given. In the worst case, maybe patient goes into respiratory failure, or there is then even ventilator support may be required. But we are talking about extreme cases. The numbers are less actually in that.
And actually those people who are succumbing to coronavirus, are they already of low immunity and predispositioned to certain ailments?
Yes. People who are generally becoming worse are people with underlying comorbid illness. That means they may be having long-standing diabetes, or they may be under treatment for some other illness which lowers their immunity, or they may be on some steroid tablets for maybe some other illness. These people are generally, and of course age, not all people elderly need to get sick, but age is definitely not a plus point. Okay, so the basic thing is, of course the severity is there. Everybody has to maintain a hand and respiratory hygiene. And of course people who are mildly sick with fever, of cough, cold, or even otherwise sick, they need to maintain their health with adequate fluids, avoid mingling around, stay at home, take rest, hydrate yourself well. And of course some supportive medications doctor would be giving, take that. And unless you are completely cured, don't venture out for work or even outside. So these are the basic things.
You're making it sound like we shouldn't panic. It sounds like
yes, definitely, because the earlier SARS virus was even more virulent than this present corona. So probably it is not like except for China, all the other countries have contained it. There are only few isolated cases which just happen to land there. And even in UAE, there is no need to panic, because actually the cases are completely quarantined and they are safe. So panicking does not help also, because then people will unnecessarily rush to hospitals. It will create a pressure on the healthcare. So you go about your work normally, and if possible avoid too many crowded places where people are sick. And if you see somebody is sick, maintain the distance. And if somebody is sick at your home, you also take appropriate action. So actually there is no need to panic, because definitely there are a lot of bodies working on it, and we'll have a way out.
The mask thing, does everyone need, you were saying that only actual coronavirus people that have been diagnosed have to wear it. So people are walking around the street, they don't need to wear it.
Lay person need not wear a mask because it doesn't protect. See, In fact, if you're not using the mask properly, it will be the other way around. When you're wearing a surgical mask, there are gaps through which bacteria can still, virus can still go, and people tend to adjust their masks frequently, and the front side of mask actually filters, and it may be loaded with pathogens, and then you are transferring it onto your hand. So mask with hand hygiene is what is required. But lay people who are going for normal work, they need not wear mask. But for healthcare professional, it's different. People who are at more risk, higher risk, for them maybe the mask, they use it more frequently depending on the situation or the persons they are in coming contact with.
So this lady that was discharged yesterday, she would have been quarantined, she would have been
Yes.
given lots of vitamins, antibiotics.
Vitamins may not have much role, but they are supportive. We can take it, no harm. She must have been given, maybe she must have been given antibiotic if there is secondary infection. We don't know the details of it, but since she has come out of it, naturally she has recovered and she has cleared the virus.
And that's mostly because of her own immune system.
Yes, because there is no specific antidote for the virus. So body clears the virus. So you support the body with the necessary things to help it come out of it.
There's a theory that HIV tablets can help. How does that happen?
Nothing has been, nothing has demonstrated till now. These so many rumors keep coming out, but these are not actually verified.
And of course, there's no vaccine yet. Do you think that
No.
we're close to one or not?
Well, it's quite difficult to say because people are working on it and nothing has been till now.
What we've learned today is that not all coronavirus cases are fatal. In fact, the vast majority of us can pass this off with the strength of our own immune system. What is important though is that if you get diagnosed with coronavirus, you actually are quarantined to keep you away from people who could be more susceptible to contracting a severe strain of the virus and thus be more susceptible to fatalities, say the young or the elderly. Ashley Hammond, Gulf News.